Doctors, we are live. You can start the session.
Okay.
A very good evening to all of you and a very hearty welcome to the felicitation of our dear winners for the image and the video competition. We've been having this going on for last few months, and we've been getting very enthusiastic participation from all our VRSI members with a number of entries for the image competition. However, we still look forward to a better number of entries coming in for our video competition. And I also extend a warm welcome to Dr. Muralidhar sir, who's the current president of VRSI. And I would now hand it over to Dr. Naresh Babu, who's heading our committee for the image and the video competition, to go ahead with the felicitation of our winners for the last 3 months of July, August, and September. Over to you, Dr. Naresh.
Thank you, Dr. Manisha. Actually, a very good evening to all. It has been a wonderful journey in the last 6-7 months. Actually, we are very happy to see wonderful images submitted by all our fellow ophthalmologists, VR surgeons. Before go into the things, we have been telling only one thing. See, please submit the image. 2 or 3 things which again I want to re-emphasize is there is no copyright with us. In case if you want to submit it as a cover page to anybody or any journal, you get free to do it, or any competition you're fine. So kindly inform us so that we will not hold the thing. And more than any of us, actually, the Chittaranjan Misra, the member of this committee, has been doing a wonderful job actually. So he's in fact handling it very effectively, single-handedly. So I would like to thank him. And with that short brief introduction, I'll hand over to Dr. Chittaranjan. So he'll be the one who will be moderating the session today. And over to you, Chittaranjan.
Thank you, Naresh sir and Manisha madam, for those kind words. It's always a pleasure to work under seniors like you. So directly we'll go to the event. So in this event, we'll be felicitating the winners of the months of July, August, and September. So coming to the month of July, the third winner goes to Silpi Narinware. Congratulations, Dr. Silpi. She is working as a ROP specialist and VR surgeon in Sarakshi Nethralaya, Nagpur. And she is one of the dynamic members of the LOC of the forthcoming VRSI Nagpur. This is the award-winning image, the devil eyes, Valsalva-induced subhyaloid and submacular hemorrhage. So may I request Dr. Silpi to speak a few words about the image. Dr. Silpi, are you available now?
I don't think Dr. Shilpi has
Yes.
joined. Dr.
So Dr. Silpi actually informed that she has some medical reason of one of her family members. So maybe I'll read on her behalf. So this is one image taken in the machine Mirante ultra wide field multimodal imaging platform. Young man, 25 years, with a history of sudden bout of coughing, presented with the image like this. And they did surgery for this patient, and the patient gained 6/6 vision from counting finger. So very nice job. Congratulations again, Dr. Silpi. This is the certificate, and Dr. Silpi wins a cash award of 2,000 rupees, which will be credited to her appropriately. Congratulations again, Dr. Silpi. Then we come to the second winner, Dr. Nivesh Gupta. Second winner of the month of July, Dr. Nivesh Gupta. Dr. Nivesh is working as an assistant professor in MGIMS Sevagram, Wardha. So this is the award-winning image, VHL with multiple angiomas. May I request Dr. Nivesh to please speak a few words about the image. Dr. Nivesh, please.
Good evening, everyone. Thank you, Vrsi, for giving me opportunity. This image is a montage image taken on Mirante Whitefield multimodal imaging. This is a case of VHL, 25-year-old female complaining diminution of vision in left eye since 1 year. History of multiple laser settings in both eyes since 10 years. History of left eye BMB with gas in case of full thickness macular hole due to ARM 6 years ago. And patient had also a family history of angiomatosis in her elder sister. on examination, BCVA in right eye 6/6, which has been some angiomas also lasered in this eye, but macular region was healthy, and left eye is 660. This image also having the fractional detachment. We operated this case and found with gain visual acuity of 6/60, and patient follow up nearly every weekly and now monthly, and patient was quite well, and she is happy with our result, that treatment.
Can you show the image again, Dr. Chitranjan?
Yes, sir. Yes, sir.
Thank you. Because I think we spend more time on the slide with the details.
Yes, sir.
So
Yes,
like
here we showing the multiple angiomas, sir, which has been lasered since 10 years.
Yeah, I mean, it's a tough case. I think that you have managed well, and a nice case to see. Yes, nice. Means now it's not in the real sense, but a good record of a very challenging disease.
Good management.
Nivesh, can you switch on your camera?
Thank
Because
you.
we would like, no, please switch on your camera. We would like to see you also, not only your image.
We should not see you only as Asharira Vani.
Yes.
Okay. So is it just the reflections are not due to any silicone oil, isn't it?
No, sir. We put down a
It's a
silicone
montage
oil.
from the Mirante. Okay.
Yeah,
Oh,
montage. It's just a reflection with the image only.
okay. Nice. Good picture. Good
It's
capture.
showing a 3D effect.
Yes.
Thank you, sir.
Good capture.
So thank you, Dr. Nivesh. As Sarah's told, nicely managed case. This is the certificate Dr. Nivesh gets, and he wins a cash award of 3,000 rupees, which will be appropriately credited to him. So congratulations again, Dr. Nivesh.
Thank you,
Then we come to the first award, Dr. Arti, first winner for the month of July. So this is the award-winning image, Leukemic Optic Nerve Infiltration. This is the award-winning image. So may I request Dr. Arti to speak a few words about it?
Very good evening, one and all. So this image is of a 42-year-old male who came with sudden loss of vision to our OPD. He was a known case of acute lymphoid leukemia and who had was in remission for almost a year. So when he came with sudden loss of vision and we dilated and examined, so this was the picture we saw with optic disc edema and a CRVO-like picture. Then MRI brain eventually revealed optic nerve infiltration. So the patient was suggested cranial irradiation and intrathecal chemotherapy. Unfortunately, we were not able to follow up this patient and we lost the patient to malignancy within 2 weeks. So this case is presented to emphasize the retinal features of hematological malignancies and how a retinologist may be the first person who diagnoses a relapse in such patients. Thank you for the opportunity.
Any comments, sir?
Thank you, Arti. I think it's a nice capture of a rare event, but it's definitely highlights the fact that, we should be aware of these kind of metastatic manifestations, infiltration of optic nerve, which can happen in these systemic diseases. It's a good image and a good capture.
Thank you.
Just a quick question, Dr. Arti. This was unilateral or a bilateral similar presentation?
This was unilateral, ma'am, only of the right eye. The other eye was normal, actually.
That's
Like towards this end, actually, he had complained of some vision difficulty in his left eye also. But then he succumbed eventually to the malignancy.
So finally, it is, the eye is a window for the systemic diseases.
Yes, sir.
Yes.
Yes.
Congratulations,
Very good.
Dr. Arti.
Thank you, sir.
So thank you again, Dr. Arti. Dr. Arti did her VR fellowship in Arvind Hospital, Pondicherry, and now she is working as a VR consultant in Chennai, Rajan Eye Care. So this is the certificate of Dr. Arti, and she wins a cash award of 5,000 rupees, which will be credited to her. Congratulations again, Dr. Arti. Then we go to the third award for the month of August, and the winner is Dr. Vinit Shah. Dr. Vinit Shah, third winner of the month of August. Dr. Vinit is working as a VR fellow at Girdhar Eye Institute, Kochi. This is the award-winning image. It's Unsettling Bonfire titled. So may I request Dr. Vineet to speak a few words on the image? Dr. Vineet.
Yes, sir. Thank you, sir. Actually, this was a 7-year-old male, sir, who presented to us with a decrease in the visual acuity in the left eye to 6/60. On fundus examination, we had a yellowish lesion on the right eye, and in the left eye, which was in the pseudo-hypopyon like stage, and in the right eye there was hemorrhage was seen. So we had a suspicion of CNVM in the left eye. So we underwent to go ahead with the OCT and OCTA. In the OCT, it showed a hyperreflectivity just below the fovea, that is the subretinal hyperreflective material, which gave us the suspicion of CNVM. And when we did the OCTA, it showed the presence of network. But as it was a bilateral symmetrical disease, so we also went ahead to do an EOG, and the EOG we found the Atten's ratio to be decreased. So the diagnosis of Best disease was CNVM was confirmed, and the patient was advised injection Avastin for the left eye.
Any comments on the image, sir? Nice image of Best disease with CNVM.
Yeah, I think this image has captured the various, both the stages quite well in the right eye and the left eye. And the title also is quite apt. Of course, Best disease is a common disease, but it's a good capture of the image and good capture of the stage. And well done, Vineet.
Thanks.
So this is the certificate. Dr. Vineet wins. Congratulations, Dr. Vineet. And he also wins CAS award of 2,000 rupees, which will be credited to him. Then coming to the second winner of the month of August, she is Dr. Bhavani. Dr. Bhavani, again, a very hardworking colleague from she's working as a medical officer in Arvind Hospital, Madurai, in the VA department. So this is the award-winning image, benign familial fleck retina. May I request Dr. Bhavani to speak a few words? Dr. Bhavani?
So back to images.
Good evening, everyone. The image which I had submitted was that of a benign familial fleck retina. Patient was an asymptomatic 52-year-old male patient, and the image showed multiple yellowish white lesions scattered from the equatorial region up to the periphery. And characteristically, it was the area around the optic disc and over the macula, it was spared. And the lesions were quite round in shape over the equatorial region, and as it moved towards the periphery, the lesions appeared more confluent and irregular in shape. ERG was done for the patient and it was normal. Patient was absolutely asymptomatic, and his best corrected visual acuity was 6/9 in both eyes with early cataract changes. So we came to a conclusion that the patient had a diagnosis of benign familial fleck retina, but we couldn't examine his other family members, though we asked him to bring them along with the following visit.
Dr. Bhavani, if the ERG was abnormal, what is the diagnosis?
Pardon, sir?
If the ERG is abnormal, maybe electronegative.
If it was electronegative, it could possibly be congenital stationary night blindness, fundus albipunctatus, sir.
I suppose patient had symmetric picture in both the eyes?
It's a bilaterally symmetrical in presentation.
Symmetrical picture. Yeah. If you had posted the picture of the other eye also, it would have been, it's good. Otherwise, it's a nice, quite a dramatic looking picture of these yellow flecks, involving the retina outside the arcades and sparing the arcades and the posterior pole. Good workup by doing an ERG also. I think it's a good case for a spotter and, kind of a refresher for everyone.
Thank you, sir.
So, Bhavani, it is taken in the Claris machine, right?
Yes, it was taken in Claris, sir.
Yes. Nice image, Bhavani. So, just to repeat, Dr. Bhavani did her fellowship in Arvind Hospital, Madurai, and she is working as a medical officer in Arvind Hospital, Madurai, in the VR department. So, yes, congratulations, Dr. Bhavani. This is the certificate, and she wins CAS award of 3,000 rupees, which will be credited to her. Then coming to the first winner, first place holder of the month of August, Dr. Ruchit Patel. So Dr. Rusik Patel, a very enthusiastic doctor who has many images to his credit in the cover page images of national and international journals and many publications on ophthalmic images, a very good friend. So the award-winning image is reverse polarity optical coherence tomography in PDR. So this is a very unique image. That's why he thinks out of the box and he gets award. So we would like to hear from Dr. Rusik how what made him think of this and how he got the award. Dr. Rusik, please. Dr. Rusik.
Thank you, Dr. Chitranjan, and for your kind introduction. Thank you, VRSI, for this opportunity. Yes, this image is of a diabetic patient, one-eyed diabetic patient, having a 624 vision. The OCTA showed the gross capillary non-perfusion areas, encouraging the macula. This image is taken in the Triton Plus Topcon Triton Plus OCT machine. There is an option in which we can change the color of the OCTA slab. So this slab, this slab is taken in reverse polarity OCTA mode, and this image has been also published on the cover page of Eye Journal in the issue of I think April 2022.
Thank you again, Rusik. Any questions for him from the panel?
No, hearty congratulations, Dr. Rusik, for getting it on the cover page of Eye Journal. I think that's extremely prestigious.
Thank you, ma'am.
It's indeed a very out-of-the-box thinking, as Dr. Chitranjan mentioned. And
thank you, ma'am.
Best to utilize the various options available in our machine. Sometimes we are not even aware of these options.
Right, ma'am.
I think just like our brain, we use only 10% of the capability of the machines.
Exactly, sir.
And all the best, congratulations, Rusik.
Thank you, sir.
So Dr. Rusik is working as a private practitioner VR surgeon in Ahmedabad and Himmatnagar. So this is the certificate Dr. Rusik gets, and he also wins cash award of 5,000 rupees. So again, congratulations. Again, back to back. So September month, 3rd of again, Dr. Rusik. This is like
a time may come where Rusik may have to withdraw from the competition, because just like Lata Mangeshkar said,
so sir,
no more Filmfare awards for me.
Sir, in
something like that.
in the month of October, they haven't included my image in the competition.
No personal enmity, Dr. Rusik, but yes, we must admit, as Dr. Murli sir told, he is becoming like Surya Kumar Yadav. He thinks he's back to back, whatever the bowler bowls. But again, the same thing. If we can see over here, again, see the reverse polarity OCTO he has utilized in BRVO, that to a follow-up patient. So very nice. Again, please, Dr. Rusik, please speak.
Sir, the patient had a vitreous hemorrhage. So we have operated the patient. Intraoperatively, we find the fibrovascular proliferation in the near the superior arcade. So we dissect the membranes and done the endolaser intraoperatively. Post-op, the patient was fine, but when patient presented, and at that time the OCTA showed the mutated component of the FBP. There was still non-perfusion areas which haven't been treated because the FA was not possible pre-operatively. When patient presented one year back, there was a development of reneovascularization around that mutated component. So we performed the add-on laser in that area, and subsequently the neovascularization was regressed. So the phenomenon was the spring, that there is a development of neovascularization when the environment is friendly.
Dr. Rusik, can you please tell us in this image, the A1, B1? So
yes,
Please tell the arrow marks. We can hear.
See,
Give us better understanding.
in A1 there is a white arrow which presents the FVP, fibrovascular trimmed fibrovascular proliferation. In A2, the orange arrow showed the same trimmed fibrovascular proliferation, showing the muted vascular component. So there was no any activity at the time of post-operative 1 month, around 1 month.
Okay.
Now in B1, you can see there is a reneovascularization marked by orange arrows.
Yes.
The white arrow showed the old trimmed FVP. And
Yes.
in B2, the octa showed the reneovascularization very distinctively.
Okay, great, Dr. Rusik. Any questions or comments for Dr. Rusik on this image?
It's a good image, actually.
Again, a good capturing of the image, and the value is that they have been able to capture serially, in the temporal sequence, showing the progression of the disease necessitating some more intervention. That is something that has been documented nicely here.
Yes, sir. Okay. So this is the text, and again, congratulations, Dr. Rusik, for the 3rd place. He gets another 2,000 rupees, which will be credited to him. So keep
Thank
sending
you.
Dr. Rusik. We don't have any personal enmity. That was
No. I understand.
Yes.
That was just on the lighter side.
No problem. Again, congratulations.
Thank you.
So
Thank you.
coming to the 2nd place winner for the month of September, this is Dr. Vaidehi. Dr. Vaidehi. So Dr. Vaidehi is working as a VR fellow at the Retina Foundation, Ahmedabad. This is the award-winning image, very nice and a great image, nicely managed also, giant retinal tear. So may I request Dr. Vaidehi to please speak a few words about the image.
Yes, sir. Good evening, everyone. This was a case of a 15-year-old male patient who had presented to us with diminution of vision in the right eye since 3 days. His vision was hand movements with perception of light and projection of rays was accurate. On examination, he had, so the picture on the right is the pre-op picture. He had almost a 180-degree giant retinal tear with rolling over of the posterior edge of the tear. A patient was treated with vitrectomy and silicone oil infusion. On 1 month follow-up, patient's vision was 660 and the retina was attached. Picture was captured on a Mirante and wide field montage is what has been displayed here.
Nice, great image. Any comments to her? Any comments from the panel?
Very good image. Only my only observation is that normally we read from left to right. So if
yes,
you interchange the images,
Yes.
probably it would have really been, that's how we look at it.
Yes.
Otherwise, they're great images and a great way to manage a very tough case, and a nice capturing of this entity, with a rolled over giant retinal tear. But I'm sure the surgeon would be having a sleepless night before he operates on this.
Thank you, sir.
Yes, sir. So this is the text, what she told us. And again, congratulations. This is the certificate she gets. And she wins cash award of 3,000 rupees, which will be credited to her. And then we come to the first award winner for the month of September, Dr. Rima Bansal. So Rima madam does not need a formal introduction. She is professor of uveitis and vitreoretina in Advanced Eye Center, PGI, Chandigarh. So the award-winning image is this one, a cilioretinal artery sparing CRO. May I request Dr. Rima madam to please speak a few words about this. Dr. Rima madam.
Thank you, Chitranjan, and very good evening to all of you. Thank you, VRSI. So this was a 30-year-old chronic smoker and hypertensive who presented with decreased vision in the left eye for a week. He had a relative afferent pupillary defect, and fundus examination showed retinal opacification, a cherry red spot, box scarring of the vessels, and a small island of retina which was perfused just temporal to the optic disc. Fundus fluorescein angiography, this was done on the Heidelberg spectralis, showed absence of retinal perfusion suggestive of central retinal artery occlusion, and a small island which was perfused suggestive of a patent coeloretinal artery. So this was a candle in the sea of darkness.
Title is very apt.
It's a very nice image. Just to be on the lighter side, you said the patient is a smoker. Does he uses the filter cigarette because of the filtering effect, his coeloretinal artery is spared?
You know, I did not ask this, and I'm not even aware.
That's on the lighter side, I'm saying. Because of the filter, I think it is same as coeloretinal artery.
But I must actually appreciate, I think I also found the title of the image very interesting.
Yes,
And maybe Rima, you can try for a cover page for this image.
I think this image befits an atlas, in entry in an atlas of retina.
Yes.
Or any textbook of retina. This is a wonderful image and capturing of a well-known thing, but the way that it's quite dramatic when we see it like this. It's very dramatic and very well captured, Rima. Very nice job.
Thank you, Dr. Murli. Thank you, Vinisha.
Yes. So
it's like a textbook picture, what we have been reading, but we barely get to see this.
Yes, ma'am. So this is the text, and this is the certificate Madam gets, first place winner.
I would just like to add, sorry, because surprisingly, this patient, his cardiology workup was normal.
Yes.
We were very sure of getting something, but turned out to be normal.
So, okay, madam. So,
it's
madam
good for the patient. It's good for the patient, but anyway, you must ask him to stop smoking. Yes, you must impress upon him. I'm sure you would have impressed upon that for the patient. So that's a very interesting observation and sharing of the detail. Thank you.
So, madam gets 5,000 rupees, which I am sure that her students will demand a treat for this, definitely. So, again, thank you, madam. Please encourage your students, and you also please keep sending images. So, with this, we'll go to before going to the next event. May I request Dr. Manisha madam to please take over.
So before we go to this, I would really like to thank the entire image team headed by Dr. Naresh. A special word of thanks and appreciation to Dr. Chitranjan for compiling all the images and all the effort that he puts in, a special effort of connecting with each one who have, submitted their images. So thank you once again. And we also have Dr. Sangeet Mittal on the committee who is taking care of all these images. I'm sure it's a very tough task to be evaluating all these images every month and then deciding amidst so many entries that which are the best 3 images. So hearty congratulations to the entire team. And moving on, we are heading for the World Diabetes Day on 14th of November, and that is why VRSI is conducting various activities, to spread awareness of diabetic retinopathy. And in that endeavor of ours, we started this poster and slogan contest, which was floated to all our members in October end. And we got very enthusiastic entries by large number of VRSI members. And we have chosen the best slogan and best poster out of all the entries. We had 4 judges, evaluating all the entries. And I want to thank all those judges, Dr. Murlidhar sir, we had Dr. Raja Lakshmi, and we had Dr. Padmaja Kumari from LVPI. And now just sharing the best tagline that we got for diabetic retinopathy.
Should I share, madam?
Yes, please. We have Dr. Mukesh Jain from LVPI Bhubaneswar. So Dr. Mukesh Jain is a VR consultant at LVPI Bhubaneswar, and let's have the interesting tagline. And if I know Dr. Mukesh is there, so why don't you read it out, Dr. Mukesh?
Am I audible? Good evening, everyone. Thank you. It was really nice to participate in this treating diabetic retinopathy is very difficult, at least in the tertiary care, because you see very difficult case scenarios and very complicated cases. So understanding that, I felt ignorance is the key to all this problem. So I made a small tagline which reads like this: Madhume को हराएंगे, retina की जांच आज ही कराएंगे, which in English means he will win the battle against diabetes and will get a retina screening today. So I think it is quite simple for everyone to understand that in diabetes, we need a retina checkup and not just a routine spectacle checkup, which most of the people get. So that was the understanding behind writing this small tagline. Thank you.
Thank you, Dr. Mukesh. And this best tagline gets you a certificate and a cash prize of 25,000 rupees, which is going to be presented to you during the annual VRSI conference. So I hope you are personally there to receive your award.
Yes. Congratulations, Mukesh.
And I'm sure we all would agree that this tagline actually communicates the very importance that we are all, really highlighting to everybody is the importance of screening on time. And I think your tagline beautifully conveys that message in one line. So congratulations once again. Muralidhar sir, any comments from you, sir?
Congratulations to Mukesh. I think it's a good, easy, and a simple tagline that everybody can understand easily. And it drives home the point very well. So as you pointed out, it is a retina key test. It's not a glasses test. It's not an eye check, which is very specific, and definitely that people will understand and probably, they would act on. Congratulations once again, and good job. I'm sure we will be using this, quite a bit in our awareness campaign.
Yes, that's exactly so what I was about to share, that we will surely try and use this in our various ongoing campaigns for DR awareness. So let's move on to the best poster, which again is for diabetic retinopathy awareness. And let's have the winner. Congratulations, Dr. Surbi. Dr. Surbi is a consultant at Vasan Eye Care, Bangalore. And let's see the poster. So our judges found this poster extremely simple and communicating the message very nicely. Dr. Surbi, would you like to share?
Thank you very much, ma'am. This is very encouraging. I'm very glad to receive this award. This is a small attempt from my side because both my grandparents suffered from diabetic retinopathy. It's a very close thing to my heart, and it gives me great joy that today I'm able to treat it as well as spread awareness about it. I would like to thank my mentors at Shankara Eye Hospital for always encouraging us to participate in VRSI activities.
So congratulations, Dr. Surbi. You also win a certificate and a cash prize of 25,000, which again would be given during the annual VRSI conference. And we will surely try and use this poster. Again, we are really, pushing the diabetologists to become aware for DR screening in their clinics. And probably this is a very nice poster which conveys the message.
Thank you, ma'am.
Yeah. There's a very nice poster because it kind of distills down the entire thing into 4 or 5 points, which are immediately, striking and, kind of drive home the point. Like first sentence says that sugars can lead problem, and second says how to prevent. Third says how it can be avoided, how it is reversible. And the last one, which is the most important, stresses on the need for eye examination. I think very well-designed poster, Surbi, and I'm sure we'll be using this in diabetic clinics. This is, of course, our attempt is to raise the awareness of the patients who visit the diabetologists, physicians, endocrinologists. And that is our focus is going to be, where we want to spread the need for eye checkup and an eye examination to those patients. And a very well done poster. Congratulations. Very well thought out.
Should I go to next slide, madam?
Yes. So
This
I
is-
just want to congratulate all the winners and thank you so much for all your enthusiastic entries for this ongoing image and video competition. Just one thing, that we are not getting as many entries for the videos, and we look forward that the entries with the interesting videos is going to increase in the coming months, and probably then we can start a proper competition for the best VR videos as well, like we are having very good entries for the image competition. I would just request Muralidhar sir and Dr. Naresh to give some concluding remarks for this competition.
Chito, can you stop sharing?
Yes, sir.
Yeah, it has been a wonderful journey actually over a period of a month. Again, we request you all to submit more images. As I have told, I think already one image was there in the cover page of I, so there will not be any issue, no copyright issue. Again, I re-emphasizing that because many people keep on asking this question. So again, I request all, and not only it is both for the members as well as non-members, those who are having postgraduates, the fellows, they can also be encouraged to send images. And with that, I hand over the mic to Muralidhar sir. Over to you, sir.
Thanks, Naresh. Thanks for a wonderful job by your team. Really congratulate you on this good job. And I can see a lot of improvement in the quality of images that have been submitted. You know, there's kind of a leap of improvement. I'm very happy about it, that now people are coming forward seriously to submit the images. That's really nice. And my suggestion to the team is, can we, like what the ASRS has, can we have all these images in an image bank that's available for anybody who wants to just see and learn? You know, that is one thing we can think of to extend it further. And please correct me if I am wrong, are we going to choose one among all these submissions as the top image of the year?
Yes, sir. Yes,
Manisha?
sir.
Yes, sir. We are going to have the best annual image.
Yeah,
Again,
amongst from these first prize,
Yes.
the ones that have won the first prize, right?
No,
Yes,
out
sir.
of all
the
first three, all first, second, and third of all the months from April to November, out of that we are going to get the best of the best image, sir.
Okay. So that will be presented at the annual conference.
Yes, sir.
It would be a good idea if we can know who is it, so that they can plan to attend in case they haven't planned. It may be a good idea if you can announce the winner soon, so that in case they have not registered, they could come and register, personally receive the award. That's my suggestion. But wonderful job by the team, the imaging team. And Manisha, as usual, has always been very, very passionate about diabetic retinopathy awareness. And it's this one, she's almost taken it up as a kind of a mission. I can see her in that. And the tagline and the posters have resulted from that kind of a passion. Very good material we have had now. I am sure next year again, we are going to invite similar contest for both the tagline and the poster for the World Diabetic Day. And thanks one and all for active participation and making this happen. And thanks to Sai and his team for giving us the technical support. And hoping to look forward to see you in physical meeting at Nagpur. And let's have a nice time at Nagpur. Looking forward to the great meeting at Nagpur.
So congratulations. Yeah, please go ahead.
Okay, please go ahead.
So I think congratulations to all the winners, and thank you for joining, and a very good night for today.
Yes. Thank you. Thank you, one and all.
Thank you, one and all.